Hi, day 3 of my ACL surgery recovery, and I'm doing okay. Still absolutely no pain at all in the knee, except when I do stuff with it. And yes, I'm still doing my exercises, my tower pulls, for example. I've got to do 250 of these reps a day, 5 sets of 50. And let me tell you, it's a real struggle to do one, because when you bring it up, it's actually fairly easy to bring it up like that, but when you do the towel pull, it's actually quite extra hard. And yeah, it's just a lot of hours. It's absolutely amazing. If you want to follow the full rehab procedure, at least the one my physio has given me, then it's a lot of hours per day, actually just doing exercises as well as icing every couple of hours. I'm putting ice on for 20 minutes probably every 2-3 hours, something like that. And that's the thing, swelling, there's no increase in swelling at all. This is pretty much maybe it's even gone down a bit in the last couple of hours, actually. Anyway, the problem with swelling is that the knee is going to stay swollen. Even if I ice it every day and follow all the instructions, it's still going to be swollen for probably a good 8 weeks, they say. That's like, up to 8 weeks, even if you still follow all the icing guidelines and things like that. But mine, I don't believe, is very swollen in the scheme of things. But yeah, your knee actually stays swollen for a long time. And also, there is pain down, well, not pain, but if I touch it, it feels quite painful down around here, because the knee fluid, actually, if you stand up a lot, I've been, walking around and everything, standing up a lot, and if you do that, then the knee fluid, the swelling, actually travels down your leg, and you can actually end up with like swollen ankles and all sorts of things. Yes, I still haven't washed off the arrow pointing up here, but yeah, because I basically keep this leg out of the bath. I have a bath and just keep it out. You can actually wrap it up with Glad wrap and have a shower and things like that, but I prefer the bath and leaving it up. And likewise, if you keep your leg elevated like this, you can get the swelling coming up your leg like this, coming back down. Gravity is a bitch. It'll get you every time. And yeah, so the swelling can actually travel up and down your leg, which is really quite remarkable. Now, one of the problems is I can walk. Let me show you. I can actually walk. Here we go. And I was able to, actually, I'm doing very good at the moment, but you'll notice the big problem is normal leg, okay? Look how straight my normal leg is, and when you walk, your leg actually straightens up. I talked about hyperextension of the leg in the previous situation. When you walk, it's normal for your leg to hyperextend like that, and that's one thing that my ACL leg does not have. It does not have the ability to really go straight. I can like really trying to keep that straight, but it's not going to be as straight as my other one. And yeah, it's got strength in it. You can walk on it. That's the other thing people don't realize. As soon as you have the ACL surgery, the moment you come out of surgery, your knee is as strong as it will ever be. The reason you can't do stuff with it is because it's all swollen and bruised or whatever. From the surgery, you don't have the range of motion. But as far as strength goes, it's all there. Now, I've actually felt quite a few things in my hamstring when I'm twisting. I actually went back to the lab, and then I went somewhere and I turned around, like not really thinking about it, and my hamstring really hurt. So yeah, you've just got to be careful. It is possible to really feel it in your hamstring. But apart from that, I don't actually feel, in normal walking, hobbling around, I don't actually feel it. So it's actually pretty good. So I'm fairly mobile at the moment. I don't actually need, apart from not being able to really straighten the leg, I think I'm doing pretty well. Look, I can walk, you know, that's actually fairly normal walking as far as I'm concerned. Well, it's not normal walking, but it's, you know, it allows me to get around without the crutches. So I'm doing pretty good. And this is only on day 3. So I'm probably not doing all of my reps and things like that I should be doing, all of my exercises. I've got another one where I have to sit on a chair and use it. They did say a skateboard, but I've been using a Tonka truck. Sitting on a chair and doing a Tonka truck just back and forth like that. And but you've got to get the angle right, and you've got to sit on a chair. You can really feel it in the hamstring if you don't get the right angle. And I've been doing those. Once again, I've got to do hundreds of reps like that, sitting on a chair. It's not as good when you sit up like this. But anyway, those, and also towels as well. I've got to push down. I've got to do 250 reps. Oh, probably can't see it, but yeah, pushing down like this. It doesn't look like I'm doing much, but I'm actually stressing my quads and everything, pushing the knee down into the towel. So it absolutely doesn't look like I'm doing, whoa, there goes the hamstring. Wow, I felt that. I really felt that then. That hurt. That's the first time I felt the hamstring that bad doing that. But I'm pushing the knee, using my muscles to push the knee down into the towel, and that's helping with the hyper extension, helping strengthen the knee. And of course I leave it up like this and just have it between a chair and just let good old, like the weight of it, oh, that hamstring, really feel it, damn. And just leave it hanging for a time period. But anyway, that's all I'm doing, is just exercises all day, every day, and icing it and keeping it up and elevated and doing things like that and just hobbling around. But yeah, I'm doing okay, but it's going to take a long time. As I said, swelling probably, well, they say could be up to 8 weeks or even more. It'll still be swollen, so I'm still getting around with a single crutch, but yeah, I might be off the crutches in a couple of days. I could be off the crutches now, but I get around faster having the crutch. I don't have to hobble as much, but I don't necessarily need the crutch to actually get around, so it's good. Tonight, I'm actually going out. I'm off to the Opera House to see Indiana Jones. Yes, Raiders of the Lost Ark at the Sydney Opera House with the full Sydney Symphony Orchestra. So beautiful, fantastic. Anyway, that's day 3. It's just boring. Sometimes you get the feeling you start to question whether or not it was the right decision, because ACL surgery is elective surgery. You choose to have it. I could have lived with no ACL. In fact, I was doing, a 14-kilometer Spartan obstacle course race with no ACL, and I was able to do it, but you can't do any sideways motion, jumping, things like that. So I chose to have the ACL operation, have the pain now, have all these issues for the next 6 months with the rehab and everything else, and then hopefully in a year's time I'll look back and say that was the best thing I ever did. That's the plan. So I'm, but you do doubt yourself, you can sit here thinking, geez, I hope in a year's time this was the right decision to actually go in and have the ACL surgery. But yeah, I'm surprised at how well I'm feeling. Actually, I'm a little bit grumpy because I can't do stuff. I'm not my usual, bouncy self, but I can certainly get around, and it's only day 3. Beauty. Anyway, catch you next time.